I'm Dr. Bostian. I'm a fellowship-trained, board-certified orthopedic surgeon specializing in hip and knee replacements at EmergeOrtho in Hickory, North Carolina. We're introducing what we call the RAMS knee, which stands for Robotic Assisted Muscle Sparing Knee Replacement. We've been doing robotic assisted knee replacements for a long time. However, we've recently added a muscle sparing technique, which has recently come into vogue because it leads to enhanced outcomes. And really in knee replacement right now, the name of the game, in my opinion, is rapid recovery. And these give really rapid recovery. These patients regain their motion rapidly. They're able to get it off the cane and walker much faster and get back to their activities of daily living. We've seen that they return to work sooner, and these patients tend to be happier much sooner than they would be with traditional knee replacements. Robotic assisted muscle sparing is a mouthful, so we have coined this the RAMS knee, and it's something unique to this region that we are doing, but we have seen excellent outcomes to date, and that's something that we'd like to introduce and bring to more and more of our patients. The benefit of muscle sparing is rapid recovery. Traditionally with knee replacements, we go through the quadriceps tendon, sometimes damage part of the muscle itself, and one of the biggest challenges with the recovery after knee replacement is regaining that muscle in your quadriceps. This leads to difficulty going up and down stairs, difficulty working on uneven surfaces, and we found a way that we can go around that tendon, that we don't have to compromise that tendon or that muscle, and these patients regain their strength much faster. Additionally, they regain their motion faster and are overall happier with these knees almost immediately after surgery. We've been doing robotic assisted surgery for a long time now. The benefit is that really we can dial in a robotically assisted knee replacement to within a ½ millimeter or a ½ degree of our goals. We can prototype the entire knee replacement before we've ever cut the bones. So for those of you who are carpenters and believe in measuring twice and cutting once, this is the way to do it. We've had great success with those. There are no surprises in these. Very rarely do you ever see a mistake with a knee replacement like this. We know exactly what this knee replacement looks like before we've ever made a cut in the bone. And so it's very important when we're making smaller incisions, when we can see less of the bone, when we can see less of the knee, that we have some assistance to make sure that the alignment is perfect, that the balance is perfect, and this is one way of doing it. We've had a number of patients who have now had this procedure on one knee and had the historic older procedure on the other knee, and it's been very clear that this is the favored approach for rapid recovery, rapid return to activity. These patients have been very happy and have noticed a huge difference from one side to the other with a muscle sparing approach. Not every patient is appropriate for a RAMS knee, but about 90% are. There are a few patients who have bad deformities or really limited range of motion that this would make a knee replacement very difficult with. But for the most part, the majority of patients are candidates for these procedures. And this is something that we discuss with our patients preoperatively, discuss which approach we want to do and any challenges that we might encounter with that specific approach before we decide our specific plan before surgery. Patient age makes no difference. This can be an appropriate approach for any patients of all ages. You know, the older we get, the less muscle mass we have, the harder it is to regain that strength. And so it is really an advantage to patients who are aging that have less muscle mass and who would have difficulty doing stairs after surgery or difficulty getting around on uneven surfaces. This is really an advantage for them because they can maintain a lot of the strength that they have. We know after a knee replacement, even a year after a knee replacement, if we measure the circumference of the thigh, a year after knee replacement, you still don't have the strength back in your thigh. It is one of the biggest challenges after a knee replacement, and this is something that really enables you to regain that strength more rapidly. The subvastus approach has been around for a long time, but not many people have employed it because there's a lot of nuances to the surgery itself. You know, there's some difficulty with it. There's some things you really have to get right. So it's something that we rolled out in a very limited fashion to appropriate patients that it was easier with, and then we progressively started rolling out to more and more patients. Now to the point where we're doing it probably on 80 to 90% of the patients, and they're doing very well. We're having great outcomes with that.